because I always forget to do that. So I'm doing it early. And again, if you're just new popping in, please mute yourself and stay muted until we get to the Q&A time, which will be at the end of this program. Your certificate and materials will be coming out next week, so look for it then. And without further ado, I would like to introduce Julie-Ann Giammona, who is of counsel with Ferber Law and the chair of CCCBA's Disability Rights Subcommittee of our DEI Committee. Julie-Ann, it's all yours.
Thank you, Teresa. Welcome, everyone. Thank you for joining us, and want to thank our speakers so much for the generosity of giving up their time today. What we're going to do is have two speakers, each about 20 minutes with a PowerPoint, and then we're going to have 20 minutes at the end for discussion, interaction, and questions. So feel free to put anything you'd like in the chat while they're speaking, but we will hold the questions since we've reserved 20 minutes for discussion at the end. So I want to introduce both of our speakers. I want to introduce Anna Acton. She is the Deputy Director for Independent Living and Community Access Division at the California Department of Rehabilitation, commonly referred to as DOR. Under this division, DOR works with independent living centers, traumatic brain injury program sites, and assistive technology services providers throughout California to provide a wide variety of disability services and supports. DOR's Disability Access section provides technical assistance and training to state and local government consumers, employers, and businesses to improve accessibility of resources, information, and employment for people with disabilities. The California Committee of Employment of People with Disabilities makes policy recommendations to improve employment outcomes for people with disabilities and puts on an annual event for youth with disabilities. Anna uses a wheelchair due to having a physical disability and has over 17 years of experience in providing direct services and leadership for independent living community-based services in California. So thank you so much, Anna, for being here. And Anna will be speaking second. So I'm going to go ahead and introduce Mark Beckley now. And Mark is with the California Department of Aging, where he has served as Chief Deputy Director since 2019. Prior to that, he has a long history in other state service. He was with the Department of Child Support Services, commonly referred to as DCSS, from 2015 to 2019 in the capacity as director for that department, and prior to that in multiple capacities, Chief Financial Officer, Deputy Director of Administration. Prior to that, he also served as the Director of Administration for the California Department of State Hospitals. And prior to that, he was with the California Department of Finance starting in 2001. So we're super happy to have all of his experience, and we welcome Mark. And Mark, go ahead and take it away with your presentation. Thank you.
Great. Thank you so much, Julie-Ann, and thank you, Teresa. I'm really delighted to be speaking to all of you today. As Julie-Ann had mentioned, I'm currently the Chief Deputy Director for the California Department of Aging. I've been in this department for about 3 years now, and really great programs, really exciting time to be working for CDA, given that we're seeing substantial growth and expansion of our programs. Particularly with current economic times, as well as with the governor's master plan for aging. Any opportunity that we get to talk about aging programs, we absolutely take it. So really, really delighted to be here with you today. And really delighted that my colleague Anna Acton from DOR could also be here as well. Anna and I, our departments work quite a bit together on aging and disability programs, since the populations, the needs of the populations that we serve have a lot in common. So next slide, please. I'd like to start off by talking about CDA's vision and mission. What I notice sometimes prior to working for CDA and just talking to people about my job is not a lot of people really know what the California Department of Aging does or what its vision and mission is. So I always like to start off with our vision and mission. And this is something that we just recently have redone. So in July of 2021, we released a new CDA strategic plan that spans from 2021 to 2025. And with the launch of the Governor's Master Plan on Aging, we decided it was time to refresh our vision and mission. So our vision is to create an age and disability friendly California where we can choose where and how we live throughout our lives. And I think the key components here is really showing strongly that partnership between aging and disability programs, the concept of choice, that individuals should be able to age in their homes and in their communities throughout their lives and have the supports that they need to do so and avoid institutionalization. And that aging is really a lifelong process. It's not something that just happens to you at a magic number. The choices that you make, the attitudes that you have with change about aging really influence your health outcomes and your quality of life later in life. And then CDA's mission is to transform aging for individuals, families, and communities by leading innovative programs, planning policies and partnerships that increase choices, equity, and well-being for all Californians as we age. And I think, again, the key components of our mission is one, the spirit that it has of being transformative. When Governor Newsom took office, one of his key goals was to launch a master plan for aging, to really come up with a deliberate strategy to provide a system of supports for all of us as we age, so that we can really enjoy our later years. And then, of course, getting to that concept of choice, that as we age, we should be able to make choices about how we live and where we live. And then underlying all of this is really the value of equity, that we really serve all Californians, regardless of race, ethnicity, income levels, and really target historically underserved communities to provide our services. Next slide. Okay, so our strategic plan, we have 5 core goals that really help us support our vision and help us implement the vision and mission of our department. And as I mentioned, the first goal is to increase choices to live at home and in the community and avoid institutionalization. And as you'll see later in the presentation, we do this through our network of local aging partners who help set up a holistic system of long-term services and supports to enable this. Second is to increase the wellness of residents in long-term facilities. We do this through our long-term care ombudsman and our newly established long-term care office of the patient representative to ensure that the rights of older adults in long-term care facilities are protected. As I mentioned in my introduction, one of our key goals is to fully implement the Master Plan for Aging. The Master Plan for Aging is a 10-year plan, and we just celebrated our first year anniversary in January. So that plan runs until 2030. And then increase public awareness and engagement around our programs. As I mentioned, aging programs seem to be rather under-publicized. Not a lot of people know what a local area agency on aging is, for instance, or all of the broad array of services that we have to offer. And then finally, to modernize CDA and our aging networks. So right now we have a lot of initiatives underway to update our technology, to be more efficient, more consistent, more reliable in terms of the data that we capture, the research that we do, updating our fiscal and contracting processes to be better about getting funds out to our providers quickly and improving and increasing the efficiency of the services we provide to older adults throughout California. Next slide. Okay. So one of the key programs that the Department of Aging is responsible for administering is the Older Americans Act program. So under the Federal Older Americans Act, the Federal Older Americans Act designates one state unit on aging per state. So we are the federally designated state unit on aging for California. And what that means is that we oversee federally designated local area agencies on aging. These are aging providers locally that provide a broad array of services and supports for older adults in communities across the state. We have 33 local area agencies on aging, and they range from county governments, JPAs, as well as nonprofit organizations. Our services are targeted at low income older adults, 60 plus. However, our programs are not means tested. So if somebody comes to us saying that they need our services, we don't question, don't ask whether or not they have resources to really meet these needs. We offer them the services. So in other words, we don't turn anybody away. And our total budget is $739 million, which is a significant increase from just 2 years ago. A lot of that is new federal stimulus funds that the department's recently received. Next slide. Okay, so I'd like to provide an overview of our Older Americans Act programs. I tend to put these into 3 categories. The first is our nutrition program. All states are required to offer a nutrition program, which is both congregate, so in-person meals that someone might share at a senior center, and home delivered, so those types of meals that might be delivered through a Meals on Wheels vendor, for instance. The second category of services are supportive services. Our AAAs have a great discretion in terms of the type of supportive services that they offer. On here, I list 5 main supportive services that they all tend to offer, and I'll talk about those in a second. And then the third category of services are really our elder rights services. So long-term care, ombudsman, and elder justice programs. And again, later in the presentation, I'll talk more about those programs. For supportive services, the main categories that are offered are information assistance. So this is when people call in and they ask questions about certain services or the availability of certain services in their programs in their communities, such as nutrition programs. Somebody at a AAA will refer them to specific programs. We also do a lot around family caregiving. So this is providing equipment, training, respite services to family caregivers, legal assistance. So all of our AAAs have contracts with local legal assistance providers who provide assistance with landlord-tenant issues, employment, age discrimination, fraud services, estate planning, so really a broad array of legal services. Then we have case management, which is if somebody needs a case manager at a AAA to help them prepare a portfolio of services that could benefit them, the AAAs are happy to do that. And then transportation. So if somebody needs transportation to medical appointments or to say an adult day health center, the AAA can help them with transportation. Next slide. So during COVID, our programs greatly expanded, and I was just so impressed by our network of local area agencies on agings and all of our service providers, the subcontractors that they work with, to really ramp up and quickly increase the number of services that they provide. So they really met the moment and responded to the needs of older adults during the COVID crisis. So our meals programs greatly expanded, again, through federal stimulus funding. We were given close to $200 million in new funding to increase our nutrition programs. And this 28 million meals served to 350,000 Californians really captures the work that we did in 2020 and then in 2021. And just as a comparison, our baseline of annual meals served was 18 million. So they increased by an additional 10 million per year during the pandemic. And actually in the current year, we're on track to go up to 32 million meals served. So just tremendous, tremendous work by our providers. In terms of information assistance, prior to the pandemic, we were responding to 800,000 phone calls a year. That increased to 1.2 million during the pandemic. CDA entered into a statewide behavioral health warm line. So some of you may have heard of this. It's called the Friendship Line, administered by the Institute on Aging. So any older adult can call into the warm line and be connected to a counselor who can help them with feelings of loneliness, depression, even suicidal ideation, and they're trained to assist them with these issues. And that was particularly important when older adults were under stay-at-home orders or were self-isolating to avoid COVID infection. And then a lot of our AAAs also set up pop-up sites or provided for transportation to and from vaccination sites so that older adults could be vaccinated. And of course, older adults were prioritized for vaccination early in the COVID pandemic. And then finally, the department purchased 4,000 iPads to help with loneliness and isolation so that they can connect to family and friends via Zoom or other social platforms, as well as access telehealth services through the iPads. Next slide. Okay, so these are some of our other home and community-based programs that we oversee. There's the CBAS program. Some of you may have heard of this through the term Adult Day Health Centers. So there's 270 CBAS sites across the state that serve 39,000 clients. And these are day programs that provide for health and social needs to older adults. And they provide a level of medical services, social activities, and keep older adults engaged and provide for care so that they can stay in their communities and continue to live in their communities. And then we have our multi-purpose senior services program, which serves 11,740 individuals, which is actually an increase of approximately 1,000 slots from a year ago. The legislature approved funding to expand the slots for the MSSP program. And this is really a team-based care model where a social worker or nurse will come into somebody's home, design a care plan for them, and then help them with referrals to the health services that they need, as well as do ongoing assessments of their need. Again, this enables somebody to continue to live in their homes and avoid institutionalization. Next slide. Okay, and this program, the Aging and Disability Resource Connection Program, is actually a program that both Anna and I share in common, in that it is a design partnership between local area agencies on aging and independent living centers overseen by the Department of Rehabilitation. And you can think of this as a one-door system, a one-stop system, where somebody can call into an ADRC, have a holistic assessment plan created for them so that they can understand all of the services and supports available in their community, and they can be handed off in a warm manner to those service providers, as opposed to having to actively seek out, make numerous phone calls themselves to receive services. The ADRC program also helps with transitions, so out of hospitals, out of skilled nursing facilities into homes, and vice versa. But yeah, they do a lot of work with transitions. And currently there are, have 33 on here, that's a typo. There's actually 24 ADRCs statewide, covering 51% of the state's population. 15 of these are what we call designated or established ADRCs, so they provide the full range of services. And then 9 are developing. So some may not be offering services currently, but they're developing the infrastructure to be able to do so, or they might offer a limited subset of the full spectrum of services that ADRC has to offer. Next slide. Okay, so I thought I would just highlight some local resources in your communities. Oh, I'm sorry. Okay, so and then this is our elder justice programs. So the long-term care ombudsman program. What this program does is it provides ombudsmen in each skilled nursing facility and residential care facilities for the elderly to investigate alleged incidents of abuse and neglect. So they commonly, at least our goal is to go into every skilled nursing facility and every residential care facility for the elderly once a quarter, check in on residents, and if we hear of any complaints of abuse or neglect, we investigate those, and in some cases, if it's egregious enough, refer to APS or to the authorities. There are currently 35 local ombudsmen throughout the state, and there's approximately 800 ombudsmen that work in this program. And annually they investigate nearly 30,000 complaints. So just an amazing number of complaints. And I'll note that during COVID, the complaint volume had somewhat increased. There's a lot of concerns about isolation among residents because of infection control procedures and visitation restrictions. So the ombudsman really worked hard to make sure that family members could safely get back into facilities and visit residents. And then the long-term care patient representative program is a new program that we are in the process of establishing this year to provide for representation for unrepresented incapacitated residents in skilled nursing facilities and ICF, so intermediate care facilities, on interdisciplinary team meetings. So if you're incapacitated and you don't have a friend or a family member who can make health decisions on your behalf, the patient rep would come in and do some research and investigation to see what your health wishes would have been, and then represent those wishes on the IDT meetings. Next slide. Okay, and then this is just some services that are offered in your area. We have the Contra Costa Area Agency on Aging, which is located in Pleasant Hill, and then our long-term care ombudsman office is in Pleasant Hill as well on Contra Costa Boulevard. I'll also mention that Contra Costa, I meant to include it on the slide, also has MSSP and CBAS services also available. Next slide. Okay, and I thought I would just highlight our master plan for aging. As I mentioned, the master plan for aging launched in January of 2020, and then, 2021. And then this year, we just celebrated our first year anniversary. We have 5 bold goals in our master plan for aging. Goal 1, housing for all ages and all stages, to make sure that there's sufficient housing available for older adults as we age, and that there's affordable housing, most importantly. Goal 2, health reimagined. So really thinking about setting up better health plan partnerships, what we can do to improve care for the elderly as we get older, and really the full spectrum of health issues, whether it's behavioral health issues or cognitive impairments, Alzheimer's, dementia, making sure that the broad array of health services are available. Goal 3 is inclusion and equity, not isolation. So under this goal area, we're looking at older employment, volunteerism, bridging the digital divide for older adults, and intergenerational supports. So really ensuring that as we grow older, we can remain active in our communities and not be isolated. Goal 4, caregiving that works. As many of you may have heard, there is a glaring shortage of caregivers statewide, paid caregivers. So a key strategy here is what can we do to augment our paid caregiver staff and take some pressure off of our family caregivers, which is our largest caregiving workforce in the state currently. And then goal 5, which is affording aging. So we talk about under this goal area, nutrition programs, fraud prevention, just whatever we can do to make aging more affordable for all of us. The master plan for aging also includes a data dashboard. So I'll show you the website in a sec, but the aging dashboard has all sorts of demographics about aging population, employment, health metrics related to older adults. So I really encourage you to check that out. And then we have a local playbook, which is basically a template. If local communities want to create their own master plans for aging, this would enable them to do so. All right, next slide. Okay, and I just want to share some links to our State Department website, to our master plan website. We have a Disability and Aging Community Living Committee that talks about shared issues in the disability and aging communities. Impact, which is our implementation stakeholder committee to implement the master plan for aging. We have an Elder and Disability Justice Coordinating Council, which might be interesting to some of you. And then an Equity and Aging Advisory Committee to make sure that all of our programs and initiatives consider equity, diversity, and inclusion in our work. And I believe that is my final slide. So again, I just want to thank Juliana and Teresa for having me here today. And at the end of the presentation, I'll be happy to answer any questions you might have. But I believe Anna's up next to talk about disability programs.
Thank you so thank you so much, Mark, for getting us started. While we're bringing the slide up here, I have been with the Department of Rehabilitation now for 10 months. So it was surprising to hear, Mark, you've been with Department of Aging for 3 years. I think we've worked together over those 3 years, just me in a different capacity. Prior to coming to the Department of Rehab, I had worked at a local level in an independent living center, actually administering Older Americans Act funding through Department of Aging and through the Department of Rehabilitation. So welcome everyone, great to be here with you. So we'll just go on to the next slide. I'm going to give a little overview of the Department of Rehabilitation and the programs and services that we provide. I'm starting here with the mission and vision, just to kind of root us in what we as a department look at with every decision and program that we provide is really rooted in our vision and mission. And our vision is really broad, with being employment independence and equality for Californians with disabilities. And I think many people may know the Department of Rehabilitation around the vocational rehabilitation and employment services that we provide. But we do so much more than that as well. And we're going to go over that today. So we really do pride ourselves in working in partnership with not just consumers, but stakeholders to provide services and advocacy resulting in employment, independent living, and equality for people with disabilities. And we'll go on to the next slide. So we have multiple different divisions. Like I said, many people think of the Department of Rehabilitation and think of the vocational rehabilitation services that we provide, which is really a core component of what we do. So I'm going to kind of quickly go through that piece. And because I really want to get to the root and my passion, which is around the independent living and community living division. But so we're going to go over quickly specialized services, our vocational rehabilitation policy and resource division, and then our vocational rehabilitation employment division. And then we'll end with our independent living and community access division. And we'll go on to the next slide. So for specialized services is really specific to supporting individuals who are deaf or hard of hearing to help them with their employment goals and outcomes. We've been working a lot as a department around community integrated employment for people with disabilities. Right now, there's a lot of work being done around eliminating sub-minimum wages for people with disabilities. Many people, especially those with developmental or intellectual disabilities, have had a long history of being paid less than minimum wage, pennies on the hour sometimes, in kind of congregate work environments. So there's been a lot of effort to integrate people with disabilities into employment opportunities in the community with their peers and with others with and without disabilities. So our specialized services, we have our blind field services program that is throughout the state, really focusing on supporting individuals who are blind or low vision, to help address some of the unmet needs to help them be gainfully employed. You know, there's a lot of assistive technology, maybe there's orientation training needed of how to navigate the world, being blind or low vision. And so we have that service. We also have our blind enterprise program. This is really providing the training and employment for persons who are legally blind through vending contracts. So many of our BEP vendors, we call them, have food services available in many state departments through this program, or even federal departments and agencies. So this is really support for them to provide food services. We also have our deaf and hard of hearing services, which provides training and interpretation services specifically to American Sign Language interpreters, and again, kind of providing those extra supports for those specific target populations who need those specific accommodations for employment. We also have an older individuals who are blind program. This is specific to individuals for 55 years or 55 years or older with a visual impairment or blind or low vision. And we have about 33 programs throughout the state that provide services to that target population. We also have the Orientation Center for the Blind and in Albany, where we really provide that immersion training for individuals who are really adjusting to having their visual impairment. So that is right there in Albany, and it's a residential facility that really immerses people in how to navigate the world as a blind individual. We'll go on to the next slide. Our VRPD, we call it Rehabilitation Policy and Resource Division, really works on collaborating with community partners to provide vocational rehabilitation services. So we have cooperative programs through our education system, through high schools, and through mental health service providers to really partner in supporting individuals with disabilities. We put a major focus on youth transition. I think the idea here, we want to engage with youth with disabilities at a young age and transition into adulthood. What we know is youth that transition into adulthood who are on disability benefits have a very low percentage of them actually get off of their disability benefits. And so the sooner we can engage and get people the skills, the education, and the supports they need to become gainfully employed, the better off they're going to be, and the less they're going to live throughout their entire life in poverty. We also have a Social Security program. So one of the focuses is for those individuals of any age that are on disability benefits, if we can get them gainfully employed and retain that employment, we actually get program income through the Social Security Administration for getting those individuals off of benefits and into employment. We're going to go on to the next slide here. So our vocational rehabilitation program really is administered through 85 offices throughout this. I think we're about 85 offices right now throughout the state. We have 13 regional districts plus the blind field services that I already talked about. And we actually are the largest vocational rehabilitation program in the country, as you may imagine, here in California. And we really provide those customized services to people with disabilities to help them either find employment or retain their employment and to live in their community of choice. Our services are consumer driven and are really supported through a whole team of counselors and other staff that are going to help support that person with their employment goal. Being person-centered and consumer driven, everything is about being goal driven and supporting that individual there where they want to live. So we'll go on to the next slide. So our team of vocational rehab counselors and other staff work to determine eligibility for services. Income eligibility here, this is really about the person having a significant disability and department having service that they benefit from. There's vocational assessment done, there's counseling and guidance and referrals to other resources and supports that are going to help that individual. There's educational and vocational training, tools and licenses for performance of an occupation.
Anna?
All right, I think I'm back.
There you are.
Can you hear me?
All right, we couldn't hear you for a minute. Are you ready for the next slide?
Yes.
You may want to turn your video off because we've been having a little bit of problem hearing you sometimes.
All righty. Well, I hope that's a little bit better. And we'll just keep going.
Great.
All righty. So yes, next slide here. Okay. So independent living. I wanted to talk a little bit about independent living philosophy to begin with, just to kind of set the tone of how the independent living side of what we do at the Department of Rehabilitation come to be. So the independent living movement really started in the 1960s as part of the civil rights movement. It actually started in the Bay Area and Berkeley. And I know how many of you are familiar with the Center for Independent Living, which was the first independent living center in the nation and actually in the world. You may be familiar with the Ed Roberts campus, which is right above the Ashby BART station there in Berkeley. So this really was part of the civil rights movement where people with disabilities came together as peers to start advocating for their rights. Remember, back in this time, there was a lot of people that were still institutionalized. People had a very hard time getting out into the community. There weren't such things as curb ramps. There weren't really programs designed to help support people to maintain living at home and in the community. People often had barriers to accessing education, including higher education, and let alone employment, right? So this movement really started with the Center for Independent Living and Ed Roberts, and there's a whole story behind that if I had more time, I would go into it. But now we see independent living centers in all 50 states, and we actually see this movement around consumer rights, consumer control, and being able to make your own decisions and direct your own life. We're seeing this spread throughout the world at this point, right? And so the services that are provided through this network of independent living centers are really based on this philosophy, right? Of nothing about us without us is one of our mottos, that people need to be at the table and need to be able to make their own decisions and be supported with a network of service providers and formal and informal networks that can help that individual live the life that they choose. So just quickly, I'll say, there's a long history of discrimination and lack of access, equal access to many facets of the community and life for people with disabilities. Some of this, we really encourage the disability conversation to be part of the diversity conversation that all of us are having, right? Diversity is part of the human existence, like race and ethnicity, right? This is something that that we're all going to experience at some time. Either disability is something that we'll experience directly, maybe we'll acquire a disability permanently or temporarily, or maybe it's a family member or a friend or someone like that. And so disability really will touch our life. Maybe we age into disability and we'll be able to benefit from the wonderful services through the AAAs that Mark went over through the Department of Aging. So disability is kind of part of diversity. And we really see it that way and see it as something to actually see it as something that is strengthens our community, strengthens our family, having that kind of diversity. So I will go on to the next slide. We really are encouraging any conversations around diversity to make sure that it includes disability. When I talk to a lot of people with disabilities and ask them what their biggest barriers are in 2022, we have worked so hard to pass laws such as the Americans with Disabilities Act, we have the Rehab Act, we have the Olmstead decision, Supreme Court decision that said people with disabilities need to live in the most integrated setting. But stigma is still what people will say. So even as we address those systematic barriers and laws that help protect the rights, these really are seen as civil rights laws for people with disabilities, there's still work to be done around the stigma and misconceptions that people might have around disability. Okay, so we're going to go on to the next slide here. Okay. So we have 28 independent living centers in the state of California. So it started with the SIL there in Berkeley with Ed Roberts, and now we have it covering every part of California. We also have an Assistive Technology Act grant that I'm going to go a little bit more into. And we are piloting a program right now called Voice Options that provides speech generating devices for individuals with speech disabilities. We have a traumatic brain injury program that I will also go over a little bit more in depth. And then I wanted to note that one of the pieces that I oversee as well is the California Committee for Employment of People with Disabilities, where we really look at what policies are needed, what recommendations that we can make to improve employment outcomes for people with disabilities. We still, unfortunately, through all this work that we've been doing, see a very high unemployment rate for people with disabilities. So we know just getting that basic access to employment opportunities and gainful employment is still something that we all need to work on, because ultimately, isn't that the gauge of real community integration, is that we're able to live in the community of our choice, which means we need the resources to be able to do that. And if we're only on benefits for our whole lives, then we're not going to be able to live the life that we necessarily envision for ourselves. So next slide. So I'm going to go over a little bit. The 28 independent living centers are really kind of, I think, a really important part of this network. Disability network of services in California. Mark talked about the Aging and Disability Resource Connections and this collaboration between Department of Rehabilitation, Department of Aging, but this was really born from a local grassroots level that really brought together these independent living centers along with the AAAs, the Area Agencies on Aging, to make sure that we're working together and supporting people with their functional needs, with their long-term service and support needs, regardless of what age the individual is, and regardless of what type of disability. And this is really important. In my intro, I use a wheelchair, you heard. I have a physical disability. I need those same modifications and to my home as maybe an older adult who maybe acquired a physical disability later in life due to a stroke or something like that. So this is really our opportunity with that ADRC to look at the functional needs of individuals and really support people regardless of what age or disability they have. So the independent living centers have actually 7 core services. Somehow I only listed 5 here. And I want to go over those just really briefly so you get an understanding of how these independent living centers support people. Now, their services are from a person-centered perspective, from a consumer-driven perspective, meaning, we meet people where they're at. We're going to provide the services that are based on their goals, not what someone tells them they should do, but what they really, because we know people are more likely to follow through if it's their idea, if it's their goals. So we do independent living skills training through the independent living centers. Really, the concept here is, give a person a fish, they eat for a day, teach a person to fish, they eat for a lifetime. What skills do individuals need to be able to better direct their life? Maybe they need help with budgeting. Maybe they need help with mobility. Maybe they need help with benefits planning, helping them develop the skills, right, that they're going to need. The next one is individual and systems advocacy. I really see this as 2 pieces, I will just say. One piece is the individual advocacy. What are, people need to know what their rights are, and it's sort of part of the empowerment model that's provided through independent living centers. So, what are my rights for housing? What are my tenant rights? What's my right to accommodations in the workplace? These are really important things, right, that help people be able to advocate for themselves. Then the next one is systems change advocacy. Some will argue this is kind of at the roots of the independent living centers and the work that they do. It's around community organizing, around addressing systemic issues that impact people with disabilities of all ages, and how to make sure our policies, our laws, right, are responsive to the needs of individuals. The next one is peer support. So the next one is peer counseling. And peer counseling is really infused into the work that independent living centers do, because they actually 51% or more of their staff and board members are people with disabilities. So it's really a consumer run organization. And so they're providing peer support one-on-one whenever they're working with individuals, or many of them do many different support groups. Information and referral is provided and ends up dovetailing really nicely into the Aging and Disability Resource Connection that Mark talked about. How do we want people to never hear no, that regardless of what they're looking for, whether the independent living center provides it or not, they get directed as easily and streamlined as possible to whatever resource they're eligible for and that they can benefit from. The next one is transition, which is really a transition and diversion service. So really working to transition people out of nursing homes and other congregate settings, other institutional settings, to community living, which can be a very comprehensive, coordinated process, right? Especially if people have been institutionalized for a period of time, we become institutionalized. We get used to not having to make our own decisions. So how do we give people the skills? Maybe they've lost their housing and their natural formal and informal support networks. So that's part of that. And the other piece of this is diversion, providing the services to people to prevent them going into a higher level of care, prevent them from becoming hospitalized, prevent them from going into a nursing home, mental health hospital, or other institutional type setting. The other two that aren't on here that I'll mention is housing. A lot of work is done around housing, helping people find housing, helping people maintain housing in a variety of different ways. And also personal attendance services. Many of the independent living centers have registries. So of course we have the in-home supportive services. If you're on Medi-Cal, you're eligible for those services, but there are many individuals, especially those in the middle income bracket, that haven't spent down to qualify for Medi-Cal and yet have these personal attendant needs that can become very expensive. And so many of the independent living centers will actually have registries to help people hire their own personal attendants, personal assistants, to be able to meet their activities of daily living needs and other support needs to maintain their independence. So our assistive technology program, I don't think I provided the link here. I'll make sure to put it in the chat unless someone else is, but there's a program called Ability Tools. And Ability Tools is who we fund to provide statewide assistive technology services. Each independent living center also has assistive technology services, but we also have the Ability Tools program through the California Foundation for Independent Living Centers. And there's a whole wide variety of services there. I would just encourage you to look at and check out. I already mentioned the Voice Options program, providing speech generating devices to people with speech disabilities, and then our traumatic brain injury program, which I could say a lot about that. And I'm looking at the time and realizing I might be running a little bit short here. So to know that individuals with traumatic brain injury might have cognitive disabilities, behavioral disabilities, or physical disabilities. And I will just say often fall through the cracks in our service delivery system. Often they need additional supports and help. Maybe the type of supports you might even see through like a developmental disability regional center. But many of these individuals would have acquired their brain injury after the age of 18 and they're not eligible. So this program is here to really help support individuals that have traumatic brain injury to reintegrate into the community, get the supports they need in their home, and then also become employed. And there's a big piece here on educating professionals on traumatic brain injuries, because people will think people are just trying to be difficult and not want services, when really there might be this underlying brain injury that needs to be accommodated. So I'm going to go on to the next slide here. The Disability Access Services section is a great resource for you and other businesses. We provide ongoing trainings at the Department of Rehabilitation on FEHA, on ADA, Americans with Disabilities Act, on how to provide accommodations, how to make sure your documents, Microsoft Word documents, are accessible. and that can really be a resource to you. We also provide one-on-one technical assistance to individuals, businesses, public entities. Can you explain how to initially access, qualify for DRS services as a minor or as an adult? Absolutely, I will give you a local office that you can contact, but basically we work with youth with disabilities, age of 14 through on and older, I guess I would say. Our transition age youth program is really focusing on that 14 to 24 years old. And often those programs are done through the local high schools and the TPPs, the transition programs through the high schools, but we can contact our local vocational rehabilitation office. So the next slide is on our initiatives. We talked about the ADRCs. Just similar to the AAAs and CDA, a lot was done around COVID-19 response. We saw the independent living centers actually increase the number of people that they were serving during COVID-19 because there was such a disproportionate impact and need. Many of them were filling in for services that were needed, working collaboratively with Department of Aging and the AAAs to fill in the gaps in services, right? If people needed access to food, for example, the CDA and the area agencies on aging had wonderful programs for older adults. And so many of these organizations filled in for younger adults with disabilities that might be disproportionately impacted by COVID-19 complications. So with that, I'm going to go on to the next slide, which is our local VR office and your local independent living center. I definitely encourage you to reach out to them. I went over other resources I'd be happy to send to all of you later to make sure you have them. But with that, thank you so much for your time. I know I covered a lot of information.
Thank you, Anna. I see one question real quick in the chat, Mark. I'm not sure if you can answer. Are undocumented individuals eligible? Do applicants need to be 55 or older to qualify for aging programs?
Right. So on the question of one's immigration status, we don't check immigration status. So anybody who comes to us requesting services, we provide them. So whether you're undocumented, documented, we don't ask immigration status. Regarding the age, our Older Americans Act programs, the federal eligibility is 60 plus, but again, we don't ask anybody their age or to show ID when they're receiving services from us. So if you're on the cusp of 60, we're not going to question you and we're not going to turn you away.
Thank you. So we didn't have as much time for questions as we had wished, but if you do have questions, please put them in the chat. We'll keep copies of those, and I'm sure the presenters will get back to you. If there's a few quick questions, we can take those real quick, but we are at our almost 1 o'clock time. If you want to unmute, if there's any couple of follow-up questions, we could do those for a couple minutes or put them in the chat, please. And if not, I want to thank both of our speakers very much for that. That was a lot of information for sure. And we appreciate that overview. My mind is kind of swimming right now with that information. So lots of follow-up things to follow up on with the info you gave us. So thank you so much for your time and generosity in speaking with us today.
Well, we were happy to be here. And again, if you have any follow-up questions, please send them my way. Be more than happy to answer them.
Great.
Absolutely. Thank you so much for your time.